Welcome to Health Simplified, brought to you by Sentara Health Plans, where we improve health every day. I'm your host, Fallon Morey, and I'm so glad you're here. No matter who you are or where you are on your health journey, this podcast is designed with you in mind. Today, we're tackling a topic that affects every woman at some point in her life: menopause. Despite being a natural transition, it's often surrounded by stigma, confusion, and even silence. But not today. Joining us to break it all down is Suzanne Coiner of Sentara Health Plans to help us navigate the realities of perimenopause, menopause, and life beyond. Welcome, Suzanne.
Thank you.
It's nice to have you here. I wanted to ask you to give us a little bit of background on yourself and what led you to a career in healthcare.
Well, I've been a nurse since 1995. I've been in healthcare since 1994. Really, what prompted me to go into healthcare was a health event for my husband, and I really was supported by the nurses at the bedside. And it was a calling. It was something that I felt that I could make a contribution and feed into the lives of others. So, and I'm interested in menopause because as a woman, I have been living that life, perimenopause, menopause, postmenopause. And so I have personal experience as well as I really want to help others understand some of the complexities around it and give them some potential solutions for how to deal with it and how to address it in their own lives.
Well, we're so glad you're here today to do that. So that kind of leads into my first question is there might be a lot of misconceptions or maybe some people who don't really understand what menopause is. So could you just give us a little overview of what menopause even is?
Absolutely. Perimenopause is really the body's response to the diminishing hormones that the ovaries produce. That's progesterone, that's estrogen, that's testosterone. It's a very natural process, and it can start as early as in your 30s, but most women start experiencing symptoms around 40, and it can range from 4 to 14 years, but on average, it's around 10 years. So when you enter menopause, that's when you no longer have your monthly period and you haven't had it for a 12-month period of time. So once you have not had your cycle for 12 months, you're considered to be in menopause. So anything after that is postmenopause, and that really lasts for the remainder of your life. However, the symptoms at any of these stages will vary. My experience is going to be different than your experience is going to be. A lot of it's based on your genetics. It's based on what your family history is, what your mom or your grandmother or your aunts experienced as well.
Interesting. So I want to go back a little to perimenopause because it sounds like this can last a while for some people and is probably what most people think of as going into menopause when you hear that. So what are some of the common symptoms and things people might commonly experience? I know you said the experience is different for everyone, but
Most frequently, women will start to notice that they're having hot flashes, power surges. Their own private summers is what I like to call.
oh, that's good.
They'll actually have night sweats, and they may have lethargy. It really affects you cognitively, physically, and emotionally. You may see that you have joint pain or that your menstrual cycle becomes more and more irregular. You may have a change in your libido or your sex drive. There are a lot of different symptoms. Not every person experiences all of them, but as I said before, they can affect you physically, they can affect you cognitively, and they can affect your emotional health as well.
Can you talk a little about the cognitive effects that symptoms can have? What might that look like for some people?
So you'll start to notice a lot of women talk about brain fog, fatigue, difficulty in multitasking. Cognitively, maybe they don't feel as sharp as they used to be or on their game. And there's a lot of contributing factors to that. Some of that can be the lack of sleep brought on by experiencing those night sweats or having those hot flashes, or just the anxiety and depression, can be another big factor for some women, not all women. And all of that plays on your mental health and can also play on your cognitive capabilities.
Are there maybe some signs or symptoms of menopause that are more extreme or might be outside what people would consider normal symptoms that people might not even realize are part of menopause?
Yes. And a lot of those could be related to your ability to process stress and your response from a depression perspective. It's not uncommon for people to have some severe reactions like panic attacks or losing interest in the things that they previously really enjoyed.
Interesting.
And so, not to scare anybody, but if you know yourself and you know that's abnormal for you, don't dismiss it. Don't let somebody just tell you it's a normal part of aging. It really is something that needs to be addressed.
So it sounds like you really need to get used to knowing yourself and checking in with yourself and self advocacy.
Definitely self advocacy. When I started my journey and I went to go see my gynecologist, he was in the mode of taking care of women who were having children and helping them with their reproductive issues. He wasn't well versed in perimenopause symptoms or menopausal symptoms. And I felt like he didn't necessarily have solutions for me. So I and to some extent I felt that it was minimized or it was just an area he didn't feel comfortable exploring. So for myself, I started looking for another physician provider that I could engage with, that I could talk to about this. And it just happened to be a woman. It doesn't have to be a woman. But there are physicians out there that have different levels of competency and different levels of experience, as well as an interest in having these kind of topics.
So I think you mentioned earlier that maybe being tired or fatigued is pretty common problem. Can you talk about maybe a little why that is?
Sure. So a lot of women experience fatigue and just aren't resting as well. A lot of it can be related to the hormonal changes themselves. Uh, the night sweats, the hot flashes, anxiety, depression, all of those can contribute to just poor rest in general. The other part of this is there are things that you can do to help you with your sleep cycle. And I would highly recommend that individuals who are experiencing fatigue and exhaustion also talk to their physician about thyroid tests to see that there's not something else medically that could be masking itself as perimenopause.
Oh, that's interesting. So some of the symptoms of menopause could be pretty common for things that women might be experiencing anyway.
Correct. The changes in your menstrual cycle can be more severe. Women can have more PMS type symptoms, breast tenderness, more mood swings, heavier cycles. If you're experiencing heavier cycles than normal, it's really important to speak to your gynecologist. You could also have fibroids or other conditions that can be treated that can help you minimize some of those symptoms.
And I think that goes back to when you say it's so important to know your own body and what you're used to experiencing your whole life, especially in this time.
Absolutely.
So, we've talked a little bit about self advocacy and speaking to your doctor. So, if you think that you might be in perimenopause, is there a test that you can do to confirm that? Or is there anything in particular you can get checked out to confirm so that you kind of know what might be caused by perimenopause versus another condition?
So there isn't a specific blood test that's going to tell you you now magically entered perimenopause. But what you can do is it's usually clinically looked at from the entire spectrum of symptoms and by ruling out any other physiological or medical conditions that could be contributing to it. Are you diabetic? Do you have a thyroid issue? Do you have fibroids? Those are some of the ones that I've already mentioned. But if you're in overall good physical health and you're starting to have some of these other symptoms that are usually pretty attributable to perimenopause, then they will make a clinical diagnosis based on how you present your overall picture medically.
Okay. So is the experience of menopause or perimenopause different for women who are of different races or ethnicities?
It can be. And so there are some studies out there that show that brown and black women, women who have a Latino background, might actually experience some of the symptoms of hot flashes and night sweats more severely or for a longer period of time.
And so, in general, what is sort of the earliest age that people can go through menopause?
So anything that would prematurely cause your ovaries to stop functioning can throw you into perimenopause and or menopause. So young women who have chemotherapy or radiation, uh, they can have perimenopause symptoms as early as whenever they had that chemotherapy or radiation. Some women have to have their ovaries surgically removed, so that's going to put you into menopause. Um, it's not uncommon to have some people experience it as early as 30 if they haven't had chemotherapy, radiation, or some other type of surgical removal of their ovaries. But a lot of that's based on your family history and what's normal for your family.
Right. So definitely if even if you're a younger age than you would maybe expect and you start to experience some of these symptoms, you should start checking with your provider if it's very different for you.
Absolutely. And everyone has a different time span of what their symptoms are going to look like. I know because the day I turned 40, I had my first hot flash and I started experiencing the symptoms. And I actually had perimenopause from 40 until 59 when I had my ovaries removed. Wow. So that's a pretty long period of time. I'm not trying to scare anybody out there. I was atypical, but there are a lot of women who have perimenopause symptoms for 4 or 5 years, or their symptoms are so mild they may not even be knowing or experiencing, recognizing that they are going through menopause. My mother swears she never had any menopausal symptoms. So, I'm atypical because usually you can look at your mother's experience or somebody else in your family and you should kind of mirror what they go through. Um, but that's not always the case. And so, again, I think knowing your body, advocating for yourself, I've heard it referred to as a second puberty. So you think about the things that you go through as a young woman when you're starting to mature, right? The mood swings, the acne, the changes to your body, your irregularity with your cycles. Think about that in reverse because a lot of those symptoms you'll still have or you will re experience when you start getting into perimenopause. You may see that your skin breaks down out more frequently. As I said before, you may have worsening symptoms around your PMS and around your cycle, right? There are a lot of things, emotional lability, that feeling like you just aren't yourself emotionally.
Right.
You can experience that, and many women do.
Can you explain what you mean by emotional lability? It's not a term I'm very familiar with, so I want to make sure our listeners know
And
it.
thank you for that, because as a nurse, I tend to sometimes use words that maybe the other people who are not clinical would not recognize. So when I'm talking about emotional ability, I'm talking about wanting to cry at the drop of a hat, or feeling sad when you normally wouldn't feel sad, having anxious moments. For myself, I never had panic attacks, but I noticed that certain driving experiences, I would actually have a panic attack. So there were things that I knew were not normal for me, and I needed to talk to somebody about that and get some help with it.
Right. And I feel sometimes like the sort of rapid emotional state is something that sort of gets attributed to women just in general, but
Exactly.
it can actually be a symptom of,
Perimenopause.
perimenopause.
Absolutely. And I think that's really important that you mention that because um, you don't want anyone to say, oh, she's just being an emotional female. That's the worst thing you can tell somebody. Um, my emotions shouldn't be minimized, they shouldn't be cast aside, and neither should anyone else's. And so, again, there's a lot of things about perimenopause that you can certainly control. Your attitude, the lifestyle adjustments, the supplements, the empowerment that you give yourself, and the support network. However, you're still going to have, in many instances, things that are beyond your control, right? Maybe that emotional fragility, or maybe those changes in your cognitive function, or those changes in your behavior health in general, right? And so don't minimize them. They're real for you, and there's ways that you can seek help around that.
Right. I think it's so important to have the conversation of listening, as we've talked about so many times now, listening to yourself and knowing that what you're experiencing isn't wrong just because you're not used to it or somebody else isn't experiencing it. In terms of what you can do for yourself, ways to treat symptoms, I want to get into that a little bit. I know there's probably a ton out there. I myself have heard a lot of things online or on social media, and you can't really trust that for medical advice. So, what are some things that you can do to kind of combat some of your symptoms? during perimenopause, or to keep yourself maybe to minimize those symptoms?
Sure. And that's a great question. So, how you minimize your symptoms, I think, first and foremost, we can do a lot of things that are simple. We can look at our diet. And things that you do in your 30s and your 40s and your 50s really help you to be healthier overall in your 60s, 70s, and 80s and 90s and beyond. So, some of the things that are proven to really work. Look at your exercise regime. You should be doing strength training 2 times a week. That helps you with bone density, it helps you with flexibility, it helps you with balance. You should be doing something for cardiovascular strengthening. They recommend 150 minutes a week of moderate exercise. It could be a walk, it could be riding your bike, it could be playing with your children. If it's more strenuous, they say maybe 75 minutes a week. So, exercise really helps you rest better. It helps create those endorphins. It helps with the mood elevation, helps with your stress, right? It helps you sleep better. Um, the diet is really important. Try to stay away from sugar products. I love my coffee in the morning, but I've really cut back on my intake of caffeine. That worsens your hot flashes. You can stay away from alcohol. A lot of people will tend to self medicate. So, if you struggle with alcohol or even substance abuse or substance use, you want to try to stay on top of that and you seek assistance before you become out of control or before you self medicate. So, alcohol might help you feel better, but it's going to impact your sleep. It's going to help you, it's going to cause you to gain weight. There's a lot of things that, and I'm not saying stay away from everything, I'm just saying do it in moderation.
Right.
Your diet, try to stay away from processed foods, decrease the amount of sugar that you intake, really focus on a plant-based diet as much as you possibly can, a Mediterranean diet with healthy oils and legumes. So, but you can't just expect that to turn you around after a week. And you have to practice some grace with yourself. You're going to have that cupcake. You're going to have a glass of wine. So it's not an all or nothing. Just make sure that consistently over time that you're practicing more healthier lifestyles.
That's a good point that, you're not gonna be perfect all the time. And so what is kind of the age that they recommend people or women start shifting to these healthier plant-based diets? Is it good to do it in your 30s and 40s, or?
Absolutely. Heart health becomes more and more critical for women, especially after they lose the protection of estrogen. So, if you're used to eating a diet that's low in saturated fats and high in healthy fats and omega 3s, you're actually protecting your heart health in your 40s and your 50s and beyond. So, that it's never too soon to start that. And it really, as you're building the bone density from those weight bearing exercises, you're actually building bone mass and muscle mass. And that's something that can help you later on in your life as well.
Is there any type of treatment for menopause that exists that involves any type of medication therapies, understanding that that advice would come from a doctor? If so,
Absolutely. So there is a lot out there about hormone replacement therapy. Again, I would always encourage people to speak to their providers about that. There's supplements. So black cohosh has been shown to decrease your uh, hot flashes, but you have to be careful because it can impact your liver. Flaxseed can help you with your night sweats. St. John worts has been attributed to decrease your mood swings. But anytime you start a supplement, you again need to tell your provider because they're not totally without the ability to have an allergic reaction to them. It could interact with the meds that you're already on. So I do recommend that people talk to their physicians if they're having difficulty sleeping or they're having increased anxiety or they're having depression. You can start medications that can help you with those. So, SSRIs they help you with the serotonin uptake. They may help you with hot flashes. Anti-anxiety meds can help you with panic attacks. Something mild like valerian root or melatonin can help you with sleep, magnesium. And so again, talk to your physician. Don't start anything without consulting with them. And I would just say you may have to try something for a while to see if it works for you.
right. So it sounds like a lot of this, it should be an ongoing dialogue between you and your provider. And so I know talking to a provider can be really overwhelming, especially when you're experiencing all these new symptoms and you think maybe you don't know what's going on in your own body. Can you give any strategies for maybe how to approach that conversation or how you might want to talk to your provider?
Absolutely. And I think one of the best strategies for talking to a provider is make a list. If you can say, these are the symptoms that I'm experiencing, and this is a frequency with which I'm experiencing them. And these are the questions that I have. Up to 80% of OBGYNs get no formal training in menopause. And so if the people who are in your reproductive health don't have a lot of knowledge about it, your PCP may not either. But I can guarantee you, if you're asking for your physician partner to be engaged, they will educate themselves. And so what you're doing is you're helping to drive them to research it, maybe partner with you so that they can learn. And not only will they be able to benefit you, but all their other female patients as well. So come prepared with a list of questions. Make sure that you can articulate what your symptoms are. And then don't take no for an answer. I would really just say advocate for yourself. Don't let somebody minimize your symptoms, whether that's a physician, whether that's a partner in life, whether that's your friends. That's how you can best, I believe, advocate for yourself.
And it sounds like in some cases you might need to find a physician partner or provider who is more of a partner and is more educated.
Absolutely. And they're out there. So you might want to do a little bit of research to see who has special background in women's health. Sometimes a doctor with a DO background can treat you more holistically. If you have the ability to, invest in your health, there are some private practices that may not be covered by insurance. There are other options, but I would say there are physician partners who are out there who are willing to engage with you in this dialogue and talk to you about what's going to work for you.
So I want to talk a little bit about how menopause is perceived now. I think when I was a kid, I never heard anybody in my life talk about going through menopause. And now people are very open about it, whether it's celebrities online or, even physicians who are writing articles or people posting things on social media. How do you think that this has affected people going through menopause and has changed the conversation?
I think it's wonderful that we're talking about perimenopause and menopause in general. Our society can tend to be fixated on youth. And, there's a whole other part of your life after you have lost the ability to bear children. And as women are going through this is natural for women. This is something 50% of the population is going to go through. And I remember growing up and had a lot of elderly aunts, and my mother and my grandmother never said a word about it. So I think that it's being out in the front and being out there where people are talking about it. It helps you. It helps you not feel so lonely. It helps you not feel isolated, right? I think it's very productive and healthy.
Do you think loneliness is something people tend to feel when they start to go through perimenopause or when they're in menopause?
Definitely loneliness can be exacerbated or made worse, right, if you don't have a good support network. So I would say if you're trying to process this by yourself, if you're not talking to your spouse or your partner, if you're not talking to your circle of friends, if you don't have individuals that you can share experiences with, or for some reason you're embarrassed by it or you think it's something that's taboo, yes, you're going to feel lonely. So I would encourage people that if they're experiencing that loneliness, first off, rule out if it's anxiety, rule out if it's depression, talk to their physician about whether or not they may need to bridge it with some type of prescribed medication. But really, you can do a lot to combat that by having a positive attitude. I know I feel better when I'm taking control. And so if I'm reaching out and talking about it amongst my friends, talking about it with my spouse, I don't feel as lonely. And I think that women need to empower themselves to talk about this. That helps combat that lonely feeling.
I think it's important that you raise the point about talking to your spouse because I feel like even in the past, sharing too much with your partner and your spouse has been seen as taboo or something that you just don't do. So what kind of things can you kind of share with your spouse about what you're going through to maybe help them understand kind of, you know, what it is you're dealing with?
Well, I think trying to hide your symptoms is a bad idea because trust me, they're going to pick up on the fact that you're pulling all the covers off, turning the fan on, that you're going to the bathroom and changing your clothes in the middle of the night. If you're one of these people who have night sweats, or if you're in the middle of a conversation, you're all of a sudden having to fan yourself because you're having a hot flash. They're going to notice this. And so, what you can do is if you talk about it and help them know that this is a normal part of your life cycle. And men also have changes in their testosterone level. They have changes in their libido. And if you're comfortable talking about it with your spouse, then you can support one another as you're both making these aging changes. And it's normal, and you can come up with solutions together. So I would definitely say educate them about what you're experiencing. Um, Ask for some grace, ask for some feedback. S- when I started going through perimenopause, I would give presentations and I would walk out almost in tears thinking that I had just ruined a presentation or done a horrible job. And I would turn to a trusted colleague and they would say, "Oh, you did great." And so sometimes your perceptions can be really altered by what's going on in your head, what's going on in your body. And I think that having your spouse or your partner engaged in that healthy feedback so that they can let you know you're not coming across the way you think you're coming
Right.
across. You're not going through this by yourself. I think that's important.
So, you know, to put a kind of a funny spin on this, I would say, what are maybe some things we can warn the partners out there that you don't say to your partner when she's going through menopause?
Please don't tell them it's all in their head. Please don't tell them that they're getting old or that they are of less value.
Right.
Don't do anything to minimize them because, I think the exciting part about this is that perimenopause can be challenging. Menopause can be challenging, but you can get out on the other side. You can minimize some of the symptoms that you're experiencing while you're going through it. You're living life the whole time that you're having this occur. And so if you can be engaging with them and just tell them, this makes me feel this way when you say that. Give them that feedback. Ask them to give you a little grace, as I mentioned before, and ask for their support. Now, granted, not everyone's in that kind of relationship, and I understand that can be harder for some individuals than others. But then you need to avail yourself of healthy outlets for these kind of discussions.
Right. So it sounds like it's really important, on top of a provider, to have some sort of trusted resource, whether it's a friend or a colleague or your partner, if your partner's not the right person to just talk to.
Absolutely. Family members, sisters, best friends, the women that you may be going to your place of worship with, coworkers. I think in my age there was a lot of stigma about talking about any of the symptoms that you may be having to your peers or your coworkers. You don't want to appear vulnerable. You don't want to appear less than competent. And so you may tend to mask that. Well, that may be your work persona, but that doesn't have to be who you are 24 hours a day. And so giving yourself the opportunity to identify trusted friends that you can share experiences with and just validate your feelings, I think is really, really important and learn from them. Right.
I think I think that's a good point you make. You don't have to be that vulnerable with everybody, but even at work, it's really possible to find that one person that ends up being your friend long after you leave that job. And so they're usually around the same age group as you, so they're probably going through what you're going through.
Yes, absolutely. And I think there's opportunities to um, look at healthy social media. I'm a cancer survivor, so I belong to several groups that are women who've had the same cancer that I had. But what I do is I try to feed some positivity into that group as a survivor. I try to acknowledge what the symptoms are that they're going through. So if it becomes an area that causes more stress for you or more conflict for you,
Right.
you can remove yourself from the group, you could take a break from the group, but there are, I think, like-minded and experiencing people out there on social media, and you can become part of that platform and actually feed into it in a positive way.
I totally agree. And thank you for sharing about your own journey with us. It sounds like there's a number of things that can go on in our lives as we get older, especially as women, that we could just use that trusted resource or that positive outlet
Absolutely.
for, especially if you're looking at how prevalent social media is.
Mhm.
But going on that, I'm curious if you think that there's any stigma or any misconceptions around any of the stages of menopause that you'd like to share that sort of.
Well, I think we've touched on the stigma around perimenopause, just because if you think about it, in your 20s, your 30s, and your 40s, you pretty much have figured out what's going on with your body, right? It's outside of pregnancy or some other things that may mess with your hormones. You know what your cycle's going to be like. You know kind of what to expect out of your body. So now all of a sudden in your 40s, you're having differences, you're having changes, and you're trying to process that. And maybe it's impacting your confidence. Maybe it's the first sign of aging. And as again, we have a big societal of preference and bent towards staying young. Right. So there's a stigma that this naturally occurring aging process is something to be avoided. And I think part of that is, in general, our culture is afraid of being fragile. They're afraid of losing their independence. They're afraid of all the things that aging can do to them.
Right.
And we as a society don't always embrace getting older. And so there is a stigma because you don't want to be perceived as losing your youth, your vitality, right? Or not functioning up to your highest level of capability. If you've worked on your career, the last thing you want is for somebody to think that you're emotionally unstable or that they can't rely on you or that you're not going to be the same partner that you've always been at work. So you may suppress and not want to speak about those things or even make people that you work with aware of it. But then again, I think that larger community, that's where they come into play. So that when you come into work, that's not your place where you're sharing all that personal stuff,
Right.
unless it's a trusted confidant.
Yes.
But that stigma is out there, and I think it exists. And it's really important for women like myself who have been there and done that to talk about the fact that it is something that you can survive and thrive in. You don't have to be limited by the perception that's out there. And I think that we are the ones who have to tell the younger women, it's going to be okay.
It's going to be fine.
It's going to be fine.
You're going to make it.
You're going to make it.
And I think, being a woman with a career where I'm in an office or around other people frequently, and also being a mom where you're around other people, it's okay to take those moments if you're having a hot flash and you need to excuse yourself. And we have this idea of go, go, go. I feel like, especially when you're a woman and you're tending to so many things, but it's okay to take time to yourself. Do you find that having gone through this, that you've learned to take more intentional time for yourself to deal with this as you've gone through it?
Absolutely. And I think that whether it's practicing yoga or it's there's cognitive behavioral therapy, which I wish I had known more about that when I was going through my journey, because that can help you retrain your mind, stay in the moment, help you deal with issues that are affecting you emotionally. But there is so much that you can do to combat some of these symptoms. And as I said before, you can be empowered as you're going through the journey.
And I believe that if you talk to your provider, or if you happen to have a behavioral health type provider, you can talk to them to give you, outside of medication, they can give you techniques like work with you with CBT or mindfulness. Is that correct?
Absolutely. So again, it could be through your provider. It could be just through your faith walk.
Okay.
I personally have found a lot of encouragement by practicing more actively in my faith walk. So it can be through a professional. And if you're not getting the results that you need, I would encourage individuals to reach out to a behavioral health professional to learn more about what's out there. It can be a combination of both. It doesn't have to be one or the other.
Okay. So when we talk about hormone replacement therapy, I know we want to obviously consult with our doctor about anything we do. But, if people are finding this podcast, they're probably pretty tuned into digital types of media, and they might have seen there's so many ads out there now for hormone replacement medicines that you can get in the mail from the internet, or, lotions or creams or pills or shots that you can get delivered to your door. So what do you think about this? And if people are seeing this and are interested in exploring it, what should they do?
Well, you're right. There is a lot of hype around these types of products, whether they're on, an ad that comes in when you're watching something else. But I would say, first and foremost, make sure that if you're going to be going down that road, talk to your provider. I know I sound like a broken record.
No, it's good advice.
They need to know what you're considering.
Right.
And you also need to consider the source. So there are some labs out there that have really good products and they have a lot of good safety testing. So if you're talking to your physicians, they can usually direct you towards um, organizations that create these supplements that have better safety records or have inspection standards. You know, I'm always fearful of buying something that's going to go into my body that I don't think has been regulated. And many of these over-the-counter things that you purchase, even in the grocery store or in the drugstore, they are not regulated the same way prescribed drugs are. That doesn't mean they can't be effective, but you want to go with not necessarily what's on sale for the week, but a brand that has some staying power and has had some studies perhaps done around them or that the physician that you're dealing with trusts.
Right. That's such good advice. Thank you for sharing that. I think it's important that if you're listening and you are seeing these ads and it's really appealing to you, please talk to your doctor, right? I think that's the biggest takeaway on anything you're going to put into your body.
And also like to add that if you're taking hormone replacement therapy, and I'm not advocating one way or the other, um, your doctor has to be testing you. They have to be looking at your hormone levels. They may have to make adjustments to the doses. And so if you're out there buying something offline or from online, you're not necessarily knowing how your body's responding to it and whether or not you're getting the right dosage levels. So that's really critical, again, to engage with a physician partner and make sure that they're helping you monitor what's going into your body.
Right. Thank you so much for sharing that. I think that's great advice. So, one thing I want to sort of talk about, since you and I both have experience working for a healthcare plan, is, started going through this when I was very young, like on the lower end of 30. And I know at that age, I was not really aware how to engage with my plan or how to set an appointment or how to see somebody that I needed to. So, can you give some advice just in general, if somebody does have insurance, how they might, start that process of trying to get in contact with a provider or get the treatment they need?
Absolutely. So, first thing is find out who is in network for you. You want it to be somebody who your plan participates with, and you're not paying a lot of medical expenses out of pocket because you're going to an out of network provider. So, a lot of times you can get that by calling member services or they're visiting their website. You can see who actually is a participating provider. You can also see what might be covered services. So that can be available online as well. And you can talk to a case manager. You can ask for a case manager to give you a phone call. They can help you find providers for your network as well. And maybe even make you aware of some of the benefits that you have as part of your health plan.
Right. So if you are seeing someone already, like a case manager at your own plan, you can also utilize them as a sort of that trusted resource to connect you to the right people.
Correct. And, especially when you start looking at medications and prescriptions, they they may be on a tiered coverage with your plan. Some of them may not be covered at all. So really understand what your out of pocket is going to be, what your financial liability is going to be, and what you may have to purchase outside of what your insurance covers.
Right. Thank you for sharing that. I know that navigating that can be really confusing. And for people who don't necessarily have access to that care, would you suggest they just see whoever they normally see as a provider on a regular basis if you don't have access to a full network? For example, if you're paying out of pocket?
Definitely, if you're paying out of pocket or you have a plan that has limited number of providers, I would start with the provider you already have a relationship with. There's nothing wrong with saying these are the areas that I need to engage with you on. I'm having these kind of symptoms, and this is where I need some help. And if they tell you, well, I'm not really an expert in that, or I can't help you with that, ask them if they know somebody they can refer you to. In many instances, you can get a referral to a specialist without necessarily getting it pre-approved by your insurance company.
Right.
If they're an in-network provider, you may not pay anything extra. So I would definitely talk. If they're not the ones who can help you, ask them to point you towards somebody who can help you.
Right. And I think it's a great point you made that, even if, you know, your doctor doesn't know. They're there to be your partner. So they're going to want to help you if they can't answer your question. And it's okay to say, I'd like to find somebody who I think can meet my needs better.
And that can be a hard conversation. I know I had to have that conversation with my provider. And, I just said, this is where your strengths are and this is where your interests are. And they're not necessarily aligned with what I'm experiencing in my health right now. So I will be looking for somebody who can help me on this part of my journey. And we had parted as friends. And I'd been followed by that particular provider for probably 20 years. So it could be challenging. And it's definitely a hard conversation. But again, at the end of the day, it's about you and about your journey and making sure that you get what you need to deal with this part in your life.
Yes, thank you. Again, that knowing yourself and what you really need is okay. We want people to know it's okay to feel like you're going through something and you need your needs met.
Mhm.
And I think that's really important. So I want to get to maybe for some people the exciting part. So we've talked a lot about the very symptomatic part of this. It's sort of a three-stage journey and that perimenopause. So once menopause is over and you're done with your cycle and you're considered postmenopausal, what does that look like? I'm assuming it's different for some women, but are there symptoms that persist? Are there things that you're still going to have to deal with, or is it kind of you're done forever?
No, I don't think it's you're done forever. But I will tell you that when you're postmenopausal, just like I mentioned before, you have that puberty stage and then you're in perimenopause, which is like the reversal of puberty. Your hormones will eventually level out. Right. And so it's very liberating not to have a monthly cycle or to go through PMS. It's the mood swings for me personally have diminished tremendously. I think it's also a time for you have more energy and you have more free time in many instances. So if your children are out of the home or perhaps some of your caregiver responsibilities have diminished, this is a time when you're still very young and you're still healthy. I know a lot of women in my age group and in my circle of friends that we're just more active than we've ever been and we feel better. And so, we're energized to volunteer, enjoy our grandchildren, travel, take on a new learning opportunity, uh, do something artistic. As long as you are engaged and enjoying every part of your life, again, those symptoms that you were experiencing have started to decrease.
Right.
You can still have hot flashes. You can still have some of the symptoms that you had with menopause or perimenopause, but they do diminish over time. And you start feeling like yourself again. And you're actually able to go into a new part of your life.
Right.
But it's really important to make sure that you're still getting your pap smears, you're still getting your mammograms, that you're practicing good heart health, that you're talking to your physician about some of the other things that you may experience as an older woman,
Right.
the increase in heart disease, the uh, osteoporosis risk that comes with aging. But it's not a death sentence. And I think that it's important for women of all ages to recognize that you can still be very vibrant, enjoying your life and making a contribution for as long as you choose to and as long as you physically can.
I think there's so much of I appreciate that positivity so much because I think that there's so much focus on what you can contribute as a woman when you're getting ready to have kids and the way your body supports that function. And if you decide not to have kids, how you can contribute as we've talked about, as a young woman in society and what kinds of things you can do that are exciting when you're young. But it sounds like there's a lot of exciting things that you can do as long as you want to do them once menopause is over.
Think about the mentorship opportunities. I'm very lucky to have women friends that are younger that come to me and ask for just career advice or want to talk to me about things they're experiencing in their personal life. You know, you have a wisdom and you've already overcome a lot of challenges, which inherently gives you more confidence.
Yeah, I was going to say, does that confidence that you sort of were talking about walking out of a thing and not sure how you did on something, right? Does that sort of come back?
Absolutely. And you get to the point where you know who you are again, and you get to the point where you feel like you're adding value. And so if society doesn't see you, it doesn't frame who you are maybe the way it did in your 20s or your 30s or your
Right.
40s. You have your own sense of self,
Right.
and you know that you can still have a vibrant and happy life.
And I'm guessing it's probably really important to keep doing those things to keep your body healthy and keep your life vibrant, like exercise.
Yes, exercise, there's unfortunately no substitute for staying active, of course. And, eating healthy, making sure that you practice those good mental health behaviors,
Right.
stay in a society, have a circle of friends, talk about your feelings, um, give yourself grace if you're having I don't like winter. And so it's really hard for me as I'm dealing with the colder weather to stay active and also just stay engaged with individuals. But I know that I have to. And so I kind of push myself through some of that. And the reward is that I feel better. I feel less depression, less seasonal affective disorder. And so knowing that you have only got one life, I say embrace it. I'm just make sure that you are not so caught up in that this is a challenge and don't let societal norms define who you are.
Right.
It's kind of free. When you're a kid and somebody asks you, what do you want to be? I feel like at my age, I'm asking myself, what do I want to be? And so,
I love that. You've given us this great message of knowing yourself, it being okay to advocate for yourself. And then, when this is all over, it can really go in this positive place where you get to even explore yourself even further. And it's probably really important to keep those trusted people in your life so you can experience, you experience the rocky times and now you can experience the good times together, I'm guessing.
absolutely. And again, I'm amazed at the women that I associate with. Um, and there's their creativity. I mean, I have friends who a few years ago, while they were working, were diagnosed with some serious heart events. They're completing 100-mile bike rides. I have women who are traveling internationally.
My legs hurt just thinking of 100-mile big ride. Is that the
And so I think there's this perception that you can only do physically challenging things when you're young, and that's not the case at all. And so, again, this is an opportunity after menopause is done or perimenopause to just kind of embrace the new you
right?
and to see what kind of challenges you want to present to yourself. Is it furthering your education? Is it starting another career? Is it just doing something to keep your mind and body active? And
Absolutely.
again, I want to encourage people that there is the other side of some of these physiological or body changes.
Well, thank you so much. I think you've given us so much to think about. It's so much good information um, that you've brought us today about this whole process because it's really a journey.
It is a joy.
Is there anything you would want to say to leave us with on this topic, or anything that's really important to you when if our listeners or somebody watching this thinks about their upcoming journey or what they're currently in?
Well, and I've said this an awful lot. I think just making sure that you don't isolate yourself and that you advocate for yourself and that don't let somebody shut you down. If you feel like there's something going on with your body, if you can't get the support you need from one source, seek out another source. Uh, at the end of the day, it's going to be about you, the health of you. If you're not healthy, if you're not getting what you need to go through this, you're not going to be there for your children. You're not going to be there for your partner. You're not going to be there for your parents. So it's not selfish to take care of yourself. It's actually, when you're in the airplane, they say give yourself the oxygen first. Think about it like that. You're taking care of yourself so you can continue to feed into and take care of others.
Thank you so much for that. It's been a pleasure having you here, and it's been so interesting. I know I learned so much, and I think our viewers and our listeners probably did too.
Well, thank you for having me, and I really enjoyed today.
Thank you so much for tuning in to Health Simplified. We hope this episode helped shed light on menopause and provided you with the information you need to navigate this stage of life with confidence. Remember to always consult with your healthcare provider before taking any action based on the information provided in this podcast. If you found this video helpful, be sure to like this video, subscribe to our channel, and hit the notification bell so you never miss an episode. Don't forget to share this content with a friend or family member who may benefit from it. Stay connected with us on Instagram and Facebook at Sentara Health Plans, and visit SentaraHealthPlans.com to learn more about our health plans and resources. Until next time, take care and stay well.